The crisp autumn air carried the scent of antiseptic through the sliding doors of Westlake Children's Hospital as Meredith Campbell guided Apollo, her 4-year-old golden retriever, across the polished lobby floor. The therapy dog's nails clicked rhythmically against the tile, his blue therapy vest immaculate as morning sunlight streamed through the east-facing windows. Apollo held his head high, carrying himself with the quiet dignity that had made him one of the hospital's most beloved visitors. Unlike some therapy dogs who bounded excitedly from patient to patient, Apollo possessed a remarkable ability to match his energy to each child's needs, gentle and subdued, with the critically ill playful with those on the mend. His amber eyes seemed to assess each situation with an almost human understanding, a quality that had earned him the nickname the Gentle Healer among the nursing staff. "Good morning, Miss Campbell," called the receptionist, her smile brightening at Apollo's wagging tail. "The 6th floor is expecting you both." Meredith nodded, adjusting her visitor badge. "Thanks, Denise. Has anyone canceled today?" "Not canceled, but there's a new patient added to your rounds. Lily Matthews' room, 612. Pneumonia case, been here about a week. Poor thing isn't responding to antibiotics as quickly as expected." The elevator doors opened to reveal Dr. Alexander Thornton, the hospital's newly appointed chief of pediatric medicine. His expression hardened instantly at the sight of Apollo, with salt and pepper hair precisely trimmed and a perpetually starched white coat. Dr. Thornton embodied clinical precision. His reputation as a brilliant diagnostician was matched only by his notorious disdain for what he termed complementary interventions, anything from art therapy to animal-assisted programs that he considered extraneous to evidence-based medicine. "Mrs. Campbell," he acknowledged stiffly, stepping out while maintaining careful distance from Apollo. "I see the animal visitation program continues despite my recommendations to the board." Meredith maintained her professional smile. At 38, she had spent enough years in corporate boardrooms before her career changed to recognize power dynamics at play. "Good morning, Dr. Thornton. The therapy program has shown exceptional results in patient recovery times and emotional well-being. The quarterly outcomes report actually shows a 15% reduction in pain medication requests on therapy visit days. Animals carry bacteria regardless of how well you bathe them." Dr. Thornton replied, his voice clipped. "These children have compromised immune systems. Every external factor introduces unnecessary risk. Apollo is cleaned using medical-grade products before every visit," Meredith countered calmly. "The protocols were developed with infectious disease specialists from Johns Hopkins. In 3 years, there hasn't been a single adverse incident attributed to the therapy program." Dr. Thornton's mouth tightened into a thin line. "Just keep that animal away from my critical cases, particularly room 612. Lily Matthews doesn't need fur in her lungs on top of pneumonia." Before Meredith could respond, he strode away, lab coat flapping behind him like a battle flag. "Huh, well, Apollo," Meredith whispered as they stepped into the elevator. "Looks like we've just been specifically asked to avoid the very patient who's been added to our rounds." Apollo looked up at her with attentive eyes that seemed to understand the complexity of the situation far more than any animal should. Meredith hadn't planned on becoming a therapy dog handler. 6 years ago, she'd been climbing the corporate ladder at a marketing firm in Boston, her life meticulously planned in quarterly targets and 5-year goals. Her corner office on the 23rd floor had offered spectacular views of the harbor, a visual reminder of her success that she rarely took time to appreciate between client meetings and strategy sessions. Then came the call that changed everything. Her niece Emma had been hospitalized after a serious bicycle accident. The 8-year-old had suffered a traumatic brain injury requiring multiple surgeries. For weeks, Emma had remained withdrawn, barely speaking to doctors or family. The child who had once been bubbly and exuberant had disappeared behind vacant eyes that stared at hospital walls. Meredith had taken emergency leave, flying across the country to support her sister. She remembered sitting in the sterile hospital room, helplessly watching Emma's silent suffering, when a chocolate Labrador named Cooper had padded into the room one Tuesday afternoon, resting his gentle head on Emma's bed. The transformation had been immediate and astonishing. Emma's first smile in weeks, followed by whispered secrets into the dog's attentive ears. That's the first time she's communicated meaningfully in days, the neurologist had remarked with undisguised amazement. It was there, watching Emma's remarkable response to the therapy animal, that Meredith first understood the profound impact these animals could have. She'd spent that night researching animal-assisted therapy, discovering studies that documented reduced stress hormones, lower blood pressure, and improved psychological outcomes across various patient populations. 2 weeks later, she resigned from her six-figure job, stunning her colleagues and supervisor. This isn't a negotiation tactic for a raise. Meredith, her boss had said, bewildered, "You're on track for the executive team within 3 years." "I know," she had replied simply, "but I've found something more important." She adopted Apollo as a 12-week-old puppy from a respected breeder who specialized in therapy dog bloodlines and invested everything in his training. They'd spent 18 months in specialized therapy dog programs, Apollo displaying an intuitive understanding that trainers described as 1 in 1,000. His certification evaluator had written simply, "Extraordinary empathy and focus, perfect temperament for pediatric work." The transition from corporate strategist to therapy dog handler hadn't been easy. Meredith had taken significant financial risks, draining her savings to support her training and certification. There had been nights of doubt when she questioned abandoning a successful career for an uncertain path. But each time Apollo connected with a child in need, each smile he coaxed from a suffering patient reinforced that she had made the right choice. Most of the medical staff had come to appreciate the program. Nurses reported that patients required less pain medication on therapy days. Physical therapists noted increased participation. Dr. Thornton remained the notable exception, citing studies on zoonotic disease transmission at every opportunity. His prestigious background in infectious disease giving weight to his objections. Meredith had researched him after their first confrontation, discovering his published papers on hospital-acquired infections and a profile in a medical journal that described him as brilliantly methodical with a relentless commitment to evidence-based protocols. What the article hadn't mentioned was his apparent inability to see beyond statistics to the human element of healing, something the nurses frequently discussed in hushed tones during coffee breaks. Nurse Isabella Rodriguez greeted them as the elevator doors opened on the 6th floor. Her colorful scrubs, covered with cartoon characters, contrasted sharply with the hospital's sterile environment, a deliberate choice to make children feel more comfortable. "Thank goodness you're here," she said, her accent slightly more pronounced when tired. "We've got several patients who could really use Apollo's magic today, especially little Noah in 607. He's facing another round of chemo and has been asking when the golden dog would return." "Dr. Thornton just specifically asked me to avoid room 612, Meredith replied hesitantly. Nurse Rodriguez frowned. "That's odd. Lily's parents actually requested the therapy program yesterday. They're desperate for anything that might lift her spirits." "Is Dr. Thornton her primary physician?" "No, that's Dr. Winters. Thornton consults on all respiratory cases. Between us," Nurse Rodriguez lowered her voice, glancing down the corridor, "he's brilliant, but has the bedside manner of a medical textbook. If the parents requested it and the attending physician hasn't objected, I'd proceed with the visit." She checked her watch. "Dr. Thornton is scheduled for rounds in the West Wing for the next hour anyway." They began their regular visits before approaching room 612. The space had the hushed atmosphere of prolonged illness, blinds partially drawn against the morning light monitors, humming quietly, the subtle scent of medical-grade disinfectant hanging in the air. Lily Matthews looked impossibly small in her hospital bed, oxygen tubes secured beneath her nose. Her chestnut hair lay limp against the pillow, face pale except for the fever's bright spots of color on her cheeks. Her mother dozed uncomfortably in the recliner beside the bedhand, still reaching toward her daughter even in sleep. Meredith knocked softly on the doorframe. "Hello, I'm Meredith Campbell with the Therapy Dog Program." Catherine Matthews startled awake, momentarily disoriented, before focusing on Apollo. She straightened, pushing back disheveled hair. "You came," she said, her voice rough from sleep. "They said you might. Is this a good time for Lily to meet Apollo?" "Please," Catherine insisted, standing to stretch her stiff muscles. "Lily has been miserable for days. The antibiotics make her nauseous, and she's having trouble sleeping with all the coughing." The little girl's eyes fluttered open, fever bright in her pale face. When her gaze landed on Apollo, a whisper of a smile touched her lips. The first genuine emotion Catherine had seen in days. "Is that for me?" Lily's voice was barely audible, scratchy from coughing. "This is Apollo," Meredith introduced, guiding the retriever closer. "He visits children here to help them feel better." Lily's hand trembled slightly as she extended it toward Apollo. The golden retriever lowered his head to make himself less imposing, his movements deliberately gentle as he approached the bed. "He's so soft," Lily whispered as her fingers connected with his fur. "Can he come up closer?" Meredith assessed the situation before spreading a clean sheet across the foot of Lily's bed. "Apollo visit," she commanded softly. Apollo placed his front paws delicately on the protected portion of the bed, keeping his body primarily on the floor, but bringing his head within easy reach. Lily's smile widened fractionally as she stroked his ears, her breathing seeming to ease slightly as she focused on something beyond her discomfort. For 20 minutes, Lily engaged with Apollo more than she had with anything in days. She giggled weakly when he balanced a toy on his nose, and her eyes widened with delight when he gently high-fived her extended hand. The transformation was subtle but significant, a hint of color returning to her cheeks, her breathing seeming marginally easier as she forgot her discomfort in Apollo's presence. 5 more minutes at Lily or Catherine eventually said, noting her daughter's drooping eyelids. "You need to rest." Meredith prepared to give the command that would bring Apollo back to heel position. "Apollo, think." She stopped mid-command, puzzled. Apollo, who had never once failed to respond instantly to instruction, remained firmly in place. His posture had changed subtly, muscles tense, attention completely focused on Lily, particularly the left side of her chest. "Apollo," Meredith repeated more firmly, "thank you." The retriever acknowledged the command with a flick of his ear but didn't move. Instead, he shifted closer to Lily, his nose working intently near her left side, nostrils flaring with concentrated sniffing. "Is something wrong?" Catherine asked, anxiety threading through her voice. "No, he's just..." Meredith hesitated, uncertain how to explain behavior she'd never seen before. "He seems very attentive to Lily." Lily's eyes had closed, exhaustion claiming her. Her breathing seemed more labored now, each inhalation a visible effort that lifted her thin shoulders. For the first time in their partnership, Apollo broke protocol completely. Instead of returning to Meredith's side, he gently laid his head directly on the bed beside Lily's left side. His body rigid with alerting behavior, the posture he'd been taught to assume when finding something significant during his basic scent training exercises. "I'm sorry," Meredith apologized, genuinely confused by her partner's behavior. "He's never done this before." A throat cleared sharply from the doorway. "What is that animal doing on my patient's bed?" Dr. Alexander Thornton stood in the entrance, his expression thunderous as he took in the scene. The overhead fluorescent lights cast harsh shadows across his face, deepening his scowl. "I specifically instructed you to avoid this room," he stated coldly. "This patient has a severe respiratory infection. Get that animal away from her immediately." Meredith moved quickly to Apollo's side, gently tugging his collar. "I'm sorry, Dr. Apollo has never refused commands before. Something seems to be bothering him about Lily's condition." "The dog is bothered by her condition." Dr. Thornton's eyebrows rose in disbelief. "The parents had requested the therapy visit, and you thought your dog's comfort services trumped medical expertise." His voice remained clinical but carried unmistakable disdain. Those last 2 words, medical expertise, delivered with particular emphasis. Catherine stepped forward protectively. "I approve the visit. Dr. Thornton, Lily has been miserable for days. This is the first time she's smiled since last weekend. Emotional comfort doesn't clear bacterial infections. Mrs. Matthews..." Dr. Thornton countered, checking Lily's monitors with practiced efficiency. Her oxygen saturation has dropped 2 points since this morning. This is precisely why I advised against animal visitation for respiratory cases. Meredith finally coaxed Apollo away. Though the dog's resistance remained unusual, in the hallway she knelt beside him, searching his behavior for clues. "What did you sense in there, boy?" she murmured, stroking his head. Apollo whined softly, his eyes still trained on the door to Lily's room. In all their years together, she'd never seen him so fixated on a patient. That evening, Meredith called her mentor, Dr. James Chen, a veterinarian who specialized in animal behavior and had pioneered several studies on working dogs' cognitive abilities. His expertise in canine scent detection had been instrumental during Apollo's training. "It's extremely unusual for Apollo to break command," she explained, pacing her small apartment as she detailed the day's events. "He seemed fixated on the left side of her chest, almost like he was alerting, but we've never trained him for medical detection. Dogs can recognize patterns and scents we cannot perceive." Dr. Chen replied thoughtfully, his voice carrying the measured cadence of someone considering multiple possibilities. "There are documented cases of untrained dogs alerting to cancer seizures, even dangerous blood sugar levels. Their olfactory capabilities are extraordinary, about 10,000 to 100,000 times more sensitive than human noses. But what could he be sensing in a pneumonia case? Difficult to say. Could be nothing, could be something the medical tests haven't caught yet. Dogs can detect subtle changes in volatile organic compounds released by the body during illness. There's emerging research suggesting they can differentiate between bacterial and viral infections based on scent alone. Should I mention it to her doctors?" Larry. Dr. Chen hesitated. Medical professionals tend to be skeptical about these things without empirical evidence. Document Apollo's behavior precisely. If the pattern repeats, then perhaps approach her primary physician, but carefully. Frame it as an observation rather than a diagnosis. After hanging up, Meredith spent hours researching canine medical detection, finding peer-reviewed studies and case reports of dogs identifying various conditions before conventional testing. Most compelling were documented instances of dogs repeatedly focusing on specific body areas, later found to contain malignancies or infections. She detailed Apollo's behavior in her therapy visit log, noting the precise location of his interest and his unprecedented refusal of commands. 2 days later, Meredith returned to the hospital. The morning air had turned sharper with the approach of winter, and the hospital's heating system created a cocoon of warmth that contrasted with the gray skies visible through the lobby windows. A light rain tapped against the glass, reflecting the somber mood she found when Nurse Rodriguez intercepted her at the nurse's station. Coffee mug clutched in both hands as though drawing warmth from it. "Lily Matthews is still on your approved list," she said quietly. "Her mother specifically requested you return, but Dr. Thornton has been quite vocal about not wanting Apollo in that room. How is Lily doing?" Nurse Rodriguez's expression conveyed professional concern. "Not well. The antibiotics aren't producing the improvement we'd expect. They've switched her to a third regimen, but her white blood cell count remains elevated and her fever isn't resolving. They're considering transferring her to University Hospital for more specialized testing." Inside room 612, Lily appeared markedly worse. Dark circles shadowed her eyes and her breathing seemed more labored, despite increased oxygen support. A new array of monitoring equipment surrounded her bed, and an IV stand held multiple bags of medication. Still, she brightened visibly when Apollo entered, struggling to sit up straighter against her pillows. "Apollo came back," she whispered, her voice even weaker than before. The visit proceeded normally until they prepared to leave. Once again, Apollo planted himself firmly beside Lily's bed, refusing to depart. This time, his focus on her left side was even more pronounced, his nose working actively as if tracking a scent. He pressed his muzzle gently against the side of her chest, then looked up at Meredith with unmistakable intent. "He's doing it again," Catherine observed, watching the dog with increasing interest. "Focusing on her left side like that," Meredith nodded slowly. Has she been complaining of any specific pain there? She mentioned some discomfort yesterday, but Dr. Thornton said it's normal with pneumonia fluid in the lungs, causing pressure. Catherine studied Apollo with new consideration. Why do you think it means something? Meredith weighed her words carefully. Mrs. Matthews, this may sound strange, but there are documented cases of dogs detecting medical conditions that haven't been diagnosed yet. Their sense of smell can identify subtle chemical changes in the body. You think Apollo is sensing something? I can't make medical claims, Meredith clarified quickly. But his behavior is extremely unusual. He's a highly trained therapy dog who has never broken protocol like this before. Catherine looked down at her daughter, whose brief energy during Apollo's visit was already fading. The worry lines around her eyes deepened as she considered the implications. Might be worth mentioning to Dr. Winters, she suggested, stroking Lily's hair back from her forehead. At this point, I'm willing to consider anything. The antibiotics aren't working, and she's getting worse instead of better. The pattern continued for 3 more visits over the following week. Each time, Apollo became increasingly insistent about remaining with Lily, focusing exclusively on her left side. Meredith documented each incident, carefully noting Lily's worsening condition despite changing antibiotic regimens. The little girl's energy diminished visibly with each visit, her brief moments of engagement with Apollo becoming more subdued. During the 4th visit, Meredith encountered Dr. Thomas Winters in the hallway outside Lily's room. The gray-haired physician looked exhausted, worry lines deepening his already weathered face. Unlike Dr. Thornton's crisp precision, Dr. Winters carried himself with the comfortable dishevelment of a man more concerned with patients than appearances. His lab coat always seemed slightly rumpled, his tie perpetually askew. Dr. Winters, could I speak with you privately about Lily Matthews? He nodded, leading her to a small consultation room where they could speak without being overheard. The space was barely larger than a closet containing just a small table and 2 chairs, but it offered rare privacy in the busy hospital. Meredith explained Apollo's unusual behavior, his specific focus on Lily's left lung area, and the research she'd compiled on animals detecting medical conditions. Her left lung does show more opacity on the x-rays. He acknowledged, rubbing his chin thoughtfully. We've attributed it to the pneumonia, but she's not responding to treatment as expected. Apollo has never behaved this way with any other patient. Meredith emphasized he's breaking years of training to alert to something near her left lung. The behavior is consistent and becoming more pronounced with each visit. Dr. Winters studied her with tired eyes that had seen thousands of cases over his long career. Ms. Campbell, I've been practicing medicine for nearly 30 years. I try to keep an open mind, especially when conventional approaches aren't working. Lily's case has been puzzling. The culture results indicate a standard bacterial pneumonia that should respond to our antibiotic protocols, but her clinical presentation suggests something more complex. Would it be possible to investigate more specifically what might be happening in her left lung? The upper portion particularly. Dr. Winters' pager beeped before he could answer. He glanced at it, his expression immediately shifting to concern. That's Lily's room. We need to go now. They rushed down the corridor to find Lily in the midst of a severe coughing fit. Each hack seemingly more painful than the last flecks of blood speckled the tissue Catherine held to her daughter's mouth. The monitor showed her oxygen saturation dropping precipitously to 87%. TO'd Blue Team to room 612. Called the responding nurse, already adjusting flow rates on Lily's oxygen. Dr. Winters moved with practiced urgency, calling for additional medical staff and a stat portable chest x-ray. In the controlled chaos, Apollo's behavior transformed completely. Gone was the calm therapy dog, replaced by an animal in obvious distress. His whines grew urgent, his body trembling with tension as he strained toward Lily's bed. "Get that dog out of here immediately," Dr. Thornton ordered as he arrived, white coat billowing behind him as he strode into the room. This is exactly what I warned about animal dander triggering a severe response. Apollo hasn't been near her today, Meredith protested. We just arrived when she began coughing. As a security officer appeared to escort them away, Apollo did something he had never done in his therapy career. He barked sharply, the sound slicing through the medical instructions and beeping monitors. Then a second bark and a third, each one directed specifically toward Lily's left side. "The dog is out of control." Dr. Thornton snapped, preparing to intubate Lily, whose breathing was becoming dangerously labored. A memory hit Meredith with jarring clarity, a research paper she'd read describing how a family dog had repeatedly barked at its owner's chest for weeks before the man was diagnosed with lung cancer. She had dismissed it as anecdotal at the time, but now, "Dr. Winters," Meredith called forcefully, "Apollo is alerting to something specific in Lily's left lung. This isn't random behavior. Something is seriously wrong beyond standard pneumonia. This isn't the time for alternative theories." Dr. Thornton interjected, positioning the intubation equipment. "It's exactly the time," Meredith insisted, speaking with an authority that surprised even herself. "He's detecting something you haven't found yet. Please just consider additional testing focused on the left lung." Specifically, Dr. Thornton approached Meredith directly, his voice lowered to an intense whisper. "Your dog is interfering with emergency medical care. Either remove him voluntarily or security will do it for you. With respect, doctor, I believe you're missing a critical diagnosis. Apollo has been alerting specifically to her left lung for over a week. This isn't pneumonia, or not just pneumonia. Based on a dog's behavior, this isn't a television drama where animals magically diagnose rare conditions. Based on documented cases of canine medical detection," Meredith corrected firmly, "dogs have identified cancers, infections, and metabolic disorders before medical tests caught them. The research from the University of Pennsylvania in medical detection dogs in the UK shows Lily's monitoring equipment suddenly emitted a shrill alarm, blood pressure dropping O2 sat at 82%. She's decompensating." Dr. Winters announced, "Prepare for emergency intubation." "Anacrunin." "Dr. Winters," Meredith called as she was being pulled from the room, "please check for fungal infections. Left lung, upper quadrant. That's where Apollo has been focusing." In the lobby, Meredith pulled out her phone and called Dr. Margaret Sullivan, chief of medicine, who had initially approved the therapy dog program. Her hands trembled slightly as she dialed Apollo, pressing anxiously against her leg. "Dr. Sullivan, this is Meredith Campbell. I need to speak with you urgently about a patient named Lily Matthews. I believe she's in life-threatening danger from a missed diagnosis." 40 minutes later, Meredith sat across from Dr. Sullivan in her office, Apollo, lying tensely at her feet. Unlike Dr. Thornton's minimalist workspace, Dr. Sullivan's office reflected a more holistic approach to medicine. Alongside her medical degrees and certifications hung children's artwork and thank you letters from patients. A bookshelf held medical texts alongside volumes on integrative medicine and patient-centered care. "Let me be clear," Dr. Sullivan said after reviewing Meredith's documentation. "You believe your therapy dog has been detecting a fungal infection in Lily's lung, something the medical team has missed. I believe Apollo is alerting to something specific in her left lung that isn't being addressed by current treatment." Meredith replied carefully, "His behavior is identical to documented cases of medical alert dogs identifying health threats." Dr. Sullivan frowned, leaning back in her chair. "While I respect the therapy program making medical recommendations based on animal behavior is well outside protocol, I understand that, but Lily has been hospitalized for nearly 2 weeks with worsening symptoms, despite appropriate antibiotic therapy. Something is being missed." The administrator checked her computer. "Lily's case has been escalated. They're preparing her for a transfer to University Medical Center. That transfer will take hours to arrange," Meredith pressed, leaning forward. "Apollo has been alerting to something urgent. Please just consider requesting specific testing for fungal infections in her left lung." Dr. Sullivan studied Meredith for a long moment, then Apollo, who maintained eye contact with an almost human intensity. "Wait here," she said, finally rising from her desk. The 20 minutes that followed were among the longest of Meredith's life. She paced the small office, stopping occasionally to reassure Apollo with gentle strokes. The dog remained alert, his body language communicating the same urgency he'd displayed in Lily's room. Finally, Dr. Sullivan returned with Dr. Winters. The primary physician looked even more exhausted than before, but there was a thoughtful determination in his eyes. "Mrs. Campbell," he began settling heavily into a chair. "I've ordered a specialized bronchial wash and fungal panel for Lily, along with high-resolution CT imaging focused on the left upper lobe." Relief weakened Meredith's knees. "Thank you for considering it." "Don't thank me yet," he cautioned. "This is highly irregular." Dr. Thornton strongly objected to changing protocol based on non-medical indicators. "What changed your mind?" Meredith asked. "Lily coughed up sputum with unusual characteristics right after you left. The pattern, it wasn't consistent with bacterial pneumonia, and frankly, nothing else in our treatment plan is working. We're running out of conventional options quickly." He hesitated, then added, "And I've learned over my career that sometimes the most valuable diagnostic tools aren't found in a laboratory." 4 hours later, Meredith's phone rang. She had been sitting in the hospital cafeteria, unable to bring herself to leave before hearing news about Lily. "Miss Campbell, this is Dr. Winters." His voice carried a mixture of astonishment and professional sobriety. "You were right. The CT scan and bronchial wash had revealed what multiple X-rays and standard protocols had missed: a small cavitary lesion in Lily's left upper lobe, harboring a significant Aspergillus infection. The fungal growth had been hidden behind denser pneumonia infiltrates invisible on the standard imaging, but gradually expanding until it reached a critical mass. Aspergilloma can mimic bacterial pneumonia symptoms while not responding to antibiotic therapy." Dr. Winters explained, "It's rare in children without underlying conditions, which is why it wasn't on our initial differential diagnosis. Lily likely inhaled the spores during renovation work at her school. The fungal ball had created a cavity approximately 2 meters in diameter." He continued, his voice taking on the measured tone of a physician carefully translating complex medical information. "The growth was positioned in such a way that it was obscured on standard X-rays by the surrounding pneumonia infiltrate. Even our routine CT scan didn't provide the resolution needed to distinguish it from consolidated lung tissue. The specialized bronchial wash revealed Aspergillus fumigatus, an invasive fungal species that can be particularly aggressive when the host immune system is already compromised by another infection." He paused, seemingly choosing his words with care. "Without detection, these fungal masses can erode into pulmonary blood vessels. When that happens," his voice trailed off, but the implication was clear. "The fact that your dog consistently alerted to the exact anatomical location is medically significant. Emergency bronchoscopy removed much of the fungal mass, and Lily began intensive antifungal therapy. Without prompt intervention, the infection would have continued expanding, potentially causing catastrophic lung bleeding or spreading to other organs." "How did your dog know?" Dr. Winters asked. "We needed specialized imaging and laboratory work to identify it. Research suggests dogs can detect volatile organic compounds released by certain fungi and bacteria." Meredith replied, "Their olfactory capabilities are thousands of times more sensitive than ours. Apollo wasn't trained for this specifically, but his basic scent discrimination training may have allowed him to recognize the abnormal compounds." Dr. Winters was quiet for a moment. "I've been practicing medicine for 30 years. Mrs. Campbell, I've seen treatments come and go. Diagnostic technologies evolve beyond recognition. But today I was reminded that sometimes the most sophisticated detection systems aren't the ones we create. They're the ones nature perfected long before we existed." When Meredith arrived at the hospital the next morning, she found not just the medical team, but also Dr. Sullivan and the hospital's research director waiting in the conference room. Most surprising was Dr. Thornton's demeanor, his hostility replaced by scientific curiosity. His usual rigid posture remained, but there was something different in his eyes, a reluctant fascination. "Miss Campbell," he began, hands folded precisely on the table before him, I've spent much of the night reviewing literature on canine scent detection in medical contexts. The capabilities are more extensively documented than I previously understood. The medical team proposed a preliminary study to evaluate therapy dogs' potential for early detection of complications. Dr. Thornton, while still expressing concerns about infection control, could not dispute the outcome in Lily's case. Now, without your dog's persistence, we would have missed a life-threatening condition until it was potentially too late. He acknowledged the admission clearly difficult for him. My concern for infection control protocols remains valid, but I recognize that we may need to develop more nuanced approaches that balance multiple factors. For over an hour, they discussed the potential implications of Apollo's detection capabilities. The research director presented preliminary proposals for a controlled study that would assess whether therapy dogs like Apollo might be formally trained to alert to specific medical conditions. Dr. Sullivan outlined regulatory considerations and patient consent protocols that would need to be developed. Throughout the meeting, Apollo lay quietly beside Meredith's chair, seemingly unaware that he had initiated what might become a significant shift in medical detection protocols. As the meeting concluded, Dr. Thornton lingered, clearly wanting to speak privately. "Ms. Campbell, I owe you an apology," he said when the others had departed. The words seemed to cost him considerable effort. "I've built my career on evidence-based medicine, on methodical application of proven protocols. The idea that an animal could detect something our advanced imaging missed." He shook his head. "It challenges fundamental assumptions." Apollo wasn't challenging medicine, Meredith offered. He was complementing it, different tools for different purposes. Dr. Thornton considered this. Perhaps that's the appropriate framework. Not alternative, but complementary detection methodologies. He straightened his already immaculate tie. "I've requisitioned several research papers on olfactory detection of disease biomarkers. Fascinating work being done at several institutions." It wasn't exactly a warm embrace of the therapy dog program, but coming from Dr. Thornton, it represented a seismic shift in perspective. The hospital corridor outside Lily's room gradually transformed over the following weeks. Get well cards multiplied daily. Colorful drawings from her classmates depicted a smiling girl beside a golden retriever wearing a cape. Nurses had started referring to room 612 as the miracle room. Lily's recovery progressed steadily after the correct diagnosis. The targeted antifungal therapy worked effectively against the Aspergillus infection, while continuing antibiotics addressed the remaining pneumonia. 3 times weekly, Apollo made official visits, his therapy vest now accompanied by a special tag reading, "Honorary Diagnostic Assistant." A small joke from the pediatric residents that carried more truth than initially intended. Dr. Winters often coincidentally checked on Lily during these visits, his questions about Apollo's training becoming increasingly specific. The literature suggests dogs might be capable of detecting certain cancers with higher sensitivity than our current screening methods. He mentioned during one such visit, "Makes you wonder what else they might perceive that we're missing entirely." More surprising was Dr. Thornton's gradual evolution. While he still maintained strict protocols about when and where Apollo could visit, he had begun quietly observing the therapy sessions, clipboard in hand. The literature is limited but intriguing. He acknowledged during one such observation, canines appear to detect certain volatile organic compounds at concentrations of parts per trillion, potentially useful for early detection modalities. 2 weeks after the diagnosis, Lily sat cross-legged on her bed, an achievement that would have been impossible before watching. As Apollo demonstrated a new trick, her color had returned. And though still thin from her ordeal, her eyes sparkled with returning health. "I'm going home tomorrow," she announced, her voice clear of the rasping quality that had characterized her long illness. "Mom says you and Apollo can visit me there too." "Absolutely," Meredith confirmed, smiling at the transformation from the desperately ill child she'd first met. "Apollo does home visits for children transitioning from the hospital care, Mom." From the doorway came an unexpected voice. "Assuming proper protocols are followed, of course." Dr. Thornton entered carrying Lily's chart, maintaining a measured distance from Apollo, but no longer acting as though the dog might contaminate the entire ward. Your latest cultures show no remaining fungal elements. He informed Lily, the CT scans show significant clearing of both the fungal cavity and bacterial infiltrates. Thanks to Apollo, Lily added with the absolute certainty of childhood. Dr. Thornton's pause was nearly imperceptible. The medical intervention was necessary, but yes, the early detection was significantly facilitated by the animal's behavior. Later that afternoon, Meredith was summoned to Dr. Sullivan's office to find not only the chief of medicine, but also Dr. Winters and Dr. Thornton waiting for her. We've been discussing the implications of Lily's case. Dr. Sullivan began reevaluating our approach to the therapy dog program. Dr. Winters slid a proposal across the desk outlining a formal protocol for tracking unusual alerting behaviors in therapy animals and establishing guidelines for when such observations warranted additional medical investigation. This isn't about dogs replacing diagnostic equipment, Dr. Thornton clarified. It's about recognizing that in certain limited circumstances, animals may detect physiological changes before they become clinically obvious through standard assessment. We're calling it the Integrated Animal Response Protocol. Dr. Sullivan added Lily's case will be submitted to the Journal of Pediatric Medicine as the initial case study. The protocol itself was remarkably comprehensive for something developed so quickly. The 20-page document outlined specific procedures for when therapy animals displayed unusual alerting behaviors, complete with observation checklists, communication pathways between handlers and medical staff, and criteria for when to escalate concerns to attending physicians. Most groundbreaking was the section on multimodal diagnostic approach that positioned animal behavior as a legitimate observational tool alongside traditional vital signs monitoring. We're not suggesting that dogs replace laboratory tests or imaging. Dr. Thornton had insisted during the drafting process, his clinical precision evident in every carefully worded paragraph. Rather, we're acknowledging that animal alerting patterns may provide early indicators that warrant further investigation through conventional medical means. The real breakthrough had been his reluctant inclusion of a sentence that would have been unimaginable weeks earlier. In cases where standard diagnostic protocols have failed to identify causative factors for persistent symptoms, documented animal alerting behavior may be considered as supportive evidence for pursuing specialized testing. The implementation of the Integrated Animal Response Protocol began the following month, with a pilot program involving 3 therapy dogs, including Apollo. Each animal's handler received specialized training in documentation and communication protocols. The medical staff participated in workshops designed to help them recognize significant animal alerting behaviors and distinguish them from normal therapy dog interactions. Meredith found herself in an unexpected role as program consultant, drawing on her corporate background to help develop training materials and assessment metrics. The skills she had once applied to marketing campaigns were now focused on creating educational resources that could potentially save lives. Dr. Thornton, somewhat to everyone's surprise, became one of the program's most meticulous architects. If we're going to do this, we're going to do it properly, he insisted during planning meetings. Anecdotal observations need to be transformed into systematic data collection. His insistence on rigorous methodology actually strengthened the program, lending it credibility among medical professionals who might otherwise have dismissed the concept entirely. He developed a classification system for animal alerts, ranging from mild interest to significant concern, with specific response protocols for each level. Catherine Matthews became an unexpected advocate, speaking at board meetings about how Apollo had detected what sophisticated medical testing had missed. Her eloquent testimony about watching her daughter recover from an infection that might have been fatal without the dog's intervention carried particular weight with hospital administrators concerned about liability issues. I understand the hesitation to incorporate animal behavior into medical protocols, she told the skeptical board members. But I ask you this, if there's even a chance that these animals can detect something our machines miss, don't we owe it to our patients to explore that possibility? 2 months after Lily's discharge, a small ceremony was held in the hospital's atrium. Lily, now fully recovered and back in school, stood proudly beside her parents as Apollo received a custom-designed honorary hospital badge. Local media covered the event, broadcasting the story of the therapy dog who detected a hidden fungal infection when medical tests missed it. Most surprising was Dr. Thornton's brief statement to the press. While maintaining appropriate infection control remains essential, we must also recognize that our patients benefit from an integrated approach to care. The canine olfactory system can detect certain compounds at concentrations far below our technological capabilities. It would be scientifically irresponsible to ignore such a potentially valuable diagnostic indicator. As cameras captured Apollo sitting perfectly beside Lily, Meredith noticed Dr. Thornton watching with what almost resembled satisfaction. "Your dog has certainly complicated my professional perspective," he commented quietly. "In a good way, I hope," Meredith replied. "Science advances through challenged assumptions, Miss Campbell." Even when the challenge comes from unexpected sources, he glanced toward Apollo. The IARP guidelines will be presented at the National Infectious Disease Conference next month. Your assistance with the presentation would be valuable. It wasn't friendship exactly, but it was respect hard-won and genuine. After the ceremony, Lily knelt to hug Apollo tightly. "You knew I was really sick when nobody else did," she whispered into his golden fur. "How did you know?" Apollo, of course, couldn't answer, but his gentle nuzzle against her now healthy chest seemed to say everything that mattered. In the year following Lily's case, the hospital's pilot program expanded to include collaborations with researchers at 3 universities. Preliminary results suggested that properly documented animal alerting behavior could indeed provide valuable early indicators of certain medical conditions, particularly those associated with specific biochemical markers. Meredith found herself traveling to medical conferences, presenting, alongside Dr. Thornton, an unlikely partnership that blended his scientific rigor with her practical experience. Their presentation at the National Pediatric Medical Association received attention from hospitals across the country interested in implementing similar programs. The integration of animal detection capabilities into traditional medical practice represents not an alternative, but a complementary diagnostic approach. Dr. Thornton would explain to audiences of skeptical physicians, "We are not replacing laboratory testing or medical imaging. We are adding another layer of detection that may capture what our technologies sometimes miss." Apollo's reputation grew beyond the hospital walls. 3 more cases of unusual alerting behavior led to early detection of medical conditions, a hidden abscess, a rare fungal skin infection, and most dramatically, an early-stage lymphoma in a child whose symptoms had been attributed to a persistent viral infection. Dr. Chen developed specialized training protocols to enhance therapy dogs' natural detection abilities, turning what had been incidental observations into more formalized responses. "We're not creating medical detection dogs from scratch," he explained to Meredith during a training session. "We're providing structure and recognition for abilities many of them already possess." The program's success attracted funding from medical research foundations interested in exploring non-traditional early detection methods. Grant money allowed for controlled studies comparing canine detection rates with standard medical diagnostics across various conditions. For Meredith, the evolution from corporate marketer to therapy dog handler to medical program consultant represented a journey she could never have anticipated. As she watched Apollo work with a new patient, a young boy recovering from transplant surgery, she reflected on the unexpected path that had brought them here. 6 years earlier, sitting in her corner office overlooking Boston Harbor, she could never have imagined that her most meaningful work would involve a golden retriever with an extraordinary nose and the persistence to make humans listen. The financial security and professional prestige of her previous career paled in comparison to watching Apollo gently interact with a child in need. Dr. Thornton approached as the therapy session concluded, his formerly perfect posture now occasionally relaxed when animals were present. "University Hospital has requested our implementation guidelines," he mentioned. "Their pediatric oncology department is particularly interested in the early detection possibilities." "That's wonderful," Meredith replied, noting how far they had come from their first contentious encounter. They're specifically requesting that you conduct their initial handler training program. He continued, your corporate background in developing training protocols has proven quite valuable in this context. Meredith smiled at the irony. The skills she had once considered abandoning when she left her corporate career had found unexpected application in this new field. Life had a way of weaving seemingly disparate threads into a coherent pattern. Oh, and Ms. Campbell, Dr. Thornton added as he turned to leave a rare smile briefly crossing his features. You'll be pleased to know that Lily's 6-month follow-up scans show complete resolution with no residual damage. Her pulmonary function tests are within normal parameters for her age. On a crisp autumn day, 1 year after their first encounter, Meredith and Apollo visited Lily's home. The Matthews suburban house was filled with the sounds of laughter as Lily hosted a celebratory 1-year well party with several friends from school. Now fully recovered, she raced around the backyard with the boundless energy of healthy childhood, pausing only when Apollo arrived. He's here, she announced to her friends, rushing to greet the dog who had changed her life. This is Apollo, the dog who saved me. The children gathered around asking questions about Apollo's abilities and watching in awe as he demonstrated his therapy dog skills. Meredith noticed with amusement how Lily had adopted the role of expert, explaining to her friends how Apollo had detected her special fungus when the doctors couldn't find it. He can smell things that are super tiny. Lily explained with the confidence of a young professor. Like 1,000,000,000,000 times better than people can. Catherine approached Meredith as the children continued playing with Apollo. We can never thank you enough, she said quietly. The doctors told us how close it was if that fungal mass had ruptured into a blood vessel. Apollo did the hard part, Meredith replied. I just translated. You fought for him to be heard, Catherine corrected. That took courage, standing up to Dr. Thornton and the entire medical establishment. Later, as the party wound down, Lily sat quietly with Apollo on the porch swing, her small hand stroking his golden fur. Mom says you're helping doctors learn how to listen to dogs better, she told Meredith. So other kids will get better too. That's right. Hospitals all over the country are starting programs like ours. Lily nodded solemnly. Apollo changed everything, didn't he? Meredith considered this simple but profound observation. Yes, he really did. As they prepared to leave, Dr. Thornton's unexpected arrival caused a moment of surprise. He stood somewhat awkwardly at the garden gate carrying a small gift bag. Dr. Thornton, Lily called, running to greet him. You came to my party. Indeed, he replied, handing her the gift. I thought you might enjoy this. Lily opened it to find a child's stethoscope and a book about medical detection dogs. Her delight was evident as she immediately placed the stethoscope around her neck. I'm going to be a doctor when I grow up, she announced, and I'm going to have dogs help me find sickness. Dr. Thornton smiled, a genuine expression that transformed his usually stern features. I think that's an excellent plan. As the sun began to set, casting long shadows across the autumn leaves, Meredith watched Apollo receive a farewell hug from Lily. The little girl whispered something in the dog's ear, a private message between patient and healer. What did you tell him? Meredith asked as they walked toward her car. I told him thank you for smelling what no one else could see. Lily replied simply, and for barking until people listen. No one. In that moment, Meredith understood that Apollo had done far more than save one child's life. He had opened a door between two worlds, the sophisticated realm of modern medicine, with its technology and protocols, and the ancient intuitive wisdom of our oldest companions. The bridge between those worlds might help countless patients whose conditions might otherwise go undetected until too late. After they'd said their goodbyes, Meredith drove home with Apollo, resting contentedly in the back seat. The golden retriever seemed entirely unaware of his profound impact on medical practice, his revolutionary contribution to diagnostic approaches, or the lives he had touched and changed forever. To Apollo, he had simply done what came naturally, detected something wrong, and persisted until it was addressed. Perhaps, Meredith reflected, that was the most important lesson of all. Sometimes the greatest wisdom comes not from complexity, but from the simple, persistent truth. Apollo had known something was wrong, And he hadn't stopped alerting until people finally listened, a reminder that healing sometimes begins not with sophisticated technology, but with the simple act of paying attention to what's right in front of us, even when it comes in unexpected forms. 3 years after Apollo's life-saving detection of Lily's fungal infection, the integrated animal response protocol had evolved far beyond its original scope. What began as a localized experiment at Westlake Children's Hospital had expanded into a nationwide initiative with 37 medical centers implementing variations of the program. The Journal of Medical Detection had dedicated an entire issue to the emerging field, featuring case studies, methodological frameworks, and preliminary statistical analyses of detection rates. On a crisp September morning, Meredith stood before an audience of 300 medical professionals at the National Medical Innovation Summit Apollo, sitting calmly beside her on the stage. The grand ballroom of the Hartwell Convention Center hummed with anticipation as she prepared to deliver the keynote address. 6 years ago, I was a marketing executive. She began, her voice carrying effortlessly through the sophisticated sound system. My concerns revolved around quarterly projections and brand positioning strategies. Today, I stand before you discussing volatile organic compounds, biomarker detection thresholds, and diagnostic sensitivity rates. A ripple of appreciative laughter moved through the audience. The journey from there to here wasn't one I planned. It began with a golden retriever who refused to follow commands, specifically his refusal to leave the bedside of a child with what appeared to be standard pneumonia. As Meredith recounted the story of Lily Matthews, she noticed Dr. Thornton sitting in the front row, nodding occasionally at her more technical points. Their unlikely partnership had become one of the most productive collaborations in the field. His rigorous scientific methodology, combined with her practical experience and communication skills, had created a framework that bridged the gap between animal behavior and medical diagnostics. In the 3 years since our initial case, the IARP network has documented 126 instances of therapy dogs alerting to undiagnosed medical conditions. Meredith continued advancing to a slide showing the statistical breakdown. Of these, 104 were subsequently confirmed through conventional testing, representing an 82.5% positive predictive value. The conditions identified range from fungal and bacterial infections to early-stage malignancies and metabolic disorders. She glanced down at Apollo, who maintained his dignified posture, despite the bright lights and large audience. What makes these results particularly significant is that these animals were not specifically trained for medical detection. They were therapy dogs whose primary role was providing comfort and emotional support. Their alerting behaviors emerged spontaneously, suggesting that, with deliberate training, detection rates could potentially be even higher. After her presentation, Meredith found herself surrounded by physicians and researchers eager to discuss implementation challenges and methodological questions. A neurosurgeon from Cleveland described how a therapy dog had repeatedly focused on a specific area of a patient's head, leading to the discovery of a small arteriovenous malformation that had been missed on initial scans. An infectious disease specialist from Atlanta shared a case of a dog alerting to a prosthetic joint infection before clinical symptoms appeared. "You've created something remarkable," Dr. Sullivan commented later as they shared coffee in a quiet corner of the convention center. The chief of medicine had become one of the program's strongest advocates, traveling frequently to help other hospitals establish their own protocols. "When you first told me your dog was detecting something our tests had missed, I thought you were, well, delusional," Meredith suggested with a smile. "I was going to say overly optimistic. But yes," Dr. Sullivan laughed. "Now we have medical schools adding modules on animal detection capabilities to their diagnostic training programs. The paradigm has shifted." Despite the growing acceptance, challenges remained. Insurance companies hesitated to cover enhanced testing based solely on animal alerting behavior, without additional clinical indications. Regulatory frameworks struggled to categorize the emerging field, and there were still skeptics within the medical community who dismissed the growing body of evidence as anecdotal coincidence. Dr. Thornton approached his customary formal attire, slightly softened by a tie featuring subtle paw prints, a gift from the pediatric residents that he wore only at conferences. The validation study results from Johns Hopkins arrived this morning. He informed them, the excitement in his voice barely contained by his professional demeanor. Their blinded trial showed an 87% detection rate for early-stage infections, significantly higher than current standard screening protocols. That should help with the Medicare coverage petition, Dr. Sullivan noted. They've been waiting for multi-center confirmation. Indeed, I've already forwarded the data to the review committee. He turned to Meredith. Your presentation was quite effective. The synthesis of statistical outcomes with case narratives provided both intellectual and emotional engagement. From Dr. Thornton, this constituted effusive praise. Thank you, Meredith replied. Apollo did most of the heavy lifting by sitting there looking dignified. Speaking of Apollo, Dr. Thornton said, glancing at the golden retriever who had stretched out beside Meredith's chair. The University of Pennsylvania's veterinary school has requested his participation in their scent discrimination study next month. Their research team is particularly interested in his ability to differentiate between bacterial and fungal biomarkers. I'll check our schedule. Meredith nodded. We're already committed to the pediatric oncology training program at Memorial, but we might be able to arrange both. Later that evening, as Meredith and Apollo walked through the convention center's adjoining gardens, she reflected on the unexpected trajectory of her life. The corporate career she had once pursued with single-minded determination now seemed like a distant memory, replaced by work that connected her to something more profound than marketing strategies and profit margins. Apollo trotted beside her, occasionally stopping to investigate an interesting scent. At 7 years old, he had reached his prime as a therapy dog, experienced enough to navigate complex environments effortlessly, yet still youthful enough to maintain his enthusiastic engagement with patients. Her phone chimed with a text message from Lily's mother. Just saw you on the medical conference live stream. Lily insisted on watching the whole thing. She's telling everyone at school that she and Apollo started a revolution, not far from the truth. Attached was a photo of Lily, now 10 years old, wearing a lab coat, several sizes too large for her slender frame stethoscope around her neck, and beside her a golden retriever puppy wearing a makeshift therapy dog vest crafted from blue fabric and white ribbon. The message continued. Meet Minerva. Lily's been training her with basic commands. She wants to know if you can recommend books on scent training for when Minerva's older. The obsession continues. Meredith smiled, showing the photo to Apollo, who sniffed at the screen with interest. Looks like you've inspired the next generation, she told him, stroking his soft ears. The following spring brought a new challenge to the program. Dr. Thornton called Meredith early one Tuesday morning, his tone uncharacteristically urgent. We have a situation at Westlake that may require Apollo's particular capabilities. He explained, a complex case that has confounded our diagnostic efforts. We'll be there in 30 minutes, Meredith replied, already reaching for Apollo's therapy vest. The patient was 14-year-old Marcus Chen, an aspiring pianist whose inexplicable neurological symptoms had baffled the medical team for nearly a month. What had begun as occasional tremors in his left hand had progressed to intermittent paralysis, severe headaches, and episodes of disorientation. We've run every test in the book, Dr. Winters explained as they stood outside Marcus's room. The physician had aged visibly in the past 3 years, his hair now completely gray, yet his compassionate approach remained unchanged. MRI, CT, spinal tap, comprehensive metabolic panels, autoimmune markers, heavy metal screening, all essentially normal. The neurologists are considering rare autoimmune encephalitis, but the antibody panels have been inconclusive. What's your instinct telling you? Meredith asked, knowing that experienced physicians often developed intuitive insights that preceded empirical confirmation. Dr. Winters hesitated. Something environmental, perhaps. The episodic nature of his symptoms suggests possible exposure, followed by partial recovery, then re-exposure. But the family has already had their home inspected for mold and other common toxins. Nothing significant was found. Marcus lay propped against pillows, his thin face pale with dark circles beneath his eyes. Despite his illness, his fingers moved constantly in subtle patterns against the bed sheets, practicing piano pieces in his mind, his mother explained. On the overbed table sat a stack of music books dog-eared from frequent use. "Hi, Marcus," Meredith greeted him. "I'm Meredith and this is Apollo. He's a therapy dog who visits patients here at the hospital." The boy's eyes brightened slightly. "I've heard about him. You're the ones who found that fungus thing in the little girl's lung, right? We learned about it in science class." That's right," Meredith confirmed, surprised by his recognition. "Apollo sometimes notices things that people might miss. Maybe he can figure out what's wrong with me," Marcus said with the bleak humor of a teenager who had endured too many medical mysteries. "The doctors sure can't." Apollo approached the bed cautiously, as he always did with new patients. His initial greeting was gentle. A soft nudge of his nose against Marcus's hand, inviting rather than demanding attention. "He's beautiful," Marcus commented, carefully stroking Apollo's head. "My piano teacher has a golden retriever, not as well behaved as this one, though." For the first 15 minutes, Apollo behaved exactly as a therapy dog should, providing calm comfort, responding to simple commands from Marcus, and generally being a pleasant distraction from the clinical environment. Meredith began to think this would be a standard visit with no unusual alerting behavior. Then Marcus's mother opened his backpack to retrieve a handheld gaming system he had requested. As the bag's contents shifted, Apollo's demeanor changed dramatically. His head snapped toward the backpack, nostrils flaring as he drew in deep breaths. With deliberate movements, he approached the bag, his focus unwavering. "He's alerting to something," Meredith explained, immediately recognizing the behavior pattern. "May I check what's in the backpack?" Mrs. Chen nodded, bewildered. "Just his school things, books, notebooks, his music scores." Apollo's focus narrowed to a worn leather case buried beneath textbooks. His nose worked rapidly, and he gave Meredith a pointed look she had come to recognize as his indication of something significant. "What's in this case?" Meredith asked carefully, lifting it out. "His raw sign for his violin bow," Mrs. Chen explained. "Marcus plays both piano and violin." Meredith opened the case to reveal a small amber block of rosin. Apollo's alerting behavior intensified the same pattern he had exhibited with Lily's fungal infection. "May I borrow this for analysis?" Meredith asked, her mind racing through possibilities. Dr. Winters, who had been observing from the doorway, stepped forward. "You think this could be related to his symptoms?" "Apollo certainly thinks so," Meredith replied. "His alerting behavior is quite specific." Later that day, the hospital's toxicology lab confirmed what Apollo had detected. The rosin contained significant levels of arsenic. Further investigation revealed that Marcus had purchased the rosin from an online marketplace specializing in discounted musical supplies. The product, manufactured in an unregulated facility overseas, had been contaminated with arsenic during production. The pattern of his symptoms suddenly made sense. They worsened after violin practice when he handled the rosin directly, then partially improved during periods when he focused more on piano. The neurological symptoms were classic manifestations of chronic arsenic poisoning, but without an obvious source of exposure. The diagnosis had remained elusive. The level of arsenic in that rosin block was extremely high. Dr. Thornton explained during the case review meeting. Each time Marcus handled it, he absorbed small amounts through his skin. Additionally, the fine dust created when applying it to the bow was likely inhaled, creating a secondary exposure route. If Apollo hadn't alerted to it, how long would it have taken to identify the source? Dr. Sullivan asked. "Potentially months." Dr. Winters admitted, "Without knowing to look for arsenic specifically, we might have continued focusing on neurological causes rather than toxicological ones." Marcus's treatment for arsenic poisoning began immediately. The FDA issued an urgent recall for all rosin blocks from the identified manufacturer, potentially preventing countless other musicians from similar exposure. During their follow-up visit 2 weeks later, Marcus greeted Apollo with genuine affection. "Mom says I have to thank you for saving my hands." He told the dog seriously, "I can't be a pianist with nerve damage." His fingers, once trembling and occasionally unresponsive, now moved with greater coordination as he demonstrated a simple scale on the portable keyboard his music teacher had brought to the hospital. The neurologist says most of the damage should be reversible since we caught it relatively early. Mrs. Chen explained her relief, evident in the softened lines of her face. Without Apollo, we might not have discovered the cause until permanent harm had occurred. As the IARP program expanded, so too did the research partnerships examining the physiological mechanisms behind canine detection abilities. Meredith and Apollo spent 1 week each month at the University of Pennsylvania's Working Dog Center, where researchers were mapping the specific volatile organic compounds that dogs could identify. The fascinating aspect isn't just what they can detect, but at what concentrations, explained Dr. Elena Rodriguez, the center's research director. She adjusted a series of gas chromatography readings on her computer screen as she spoke. Apollo consistently alerts to certain fungal compounds at concentrations below 5 parts per trillion. Our most sensitive electronic detection equipment requires concentrations at least 10 times higher. The laboratory combined cutting-edge technology with thoughtfully designed canine testing protocols. In one room, automated scent delivery systems presented controlled samples to working dogs, while sophisticated monitoring equipment tracked their physiological responses, heart rate variability, respiration patterns, subtle changes in body temperature, and microscopic muscle movements that preceded obvious alerting behaviors. We're essentially reverse engineering their detection process. Dr. Rodriguez continued, when a dog like Apollo alerts to a medical condition, we analyze what specific compounds are present, then isolate and confirm which ones trigger the alert response. This scientific understanding helped address skepticism from the medical establishment. No longer was canine detection dismissed as mysterious or anecdotal. It had specific biochemical foundations that could be measured, studied, and eventually translated into improved detection technologies. Dr. Thornton had become a surprising champion of this research, bringing his rigorous methodological expertise to study designs and data analysis. The infectious disease specialist, who had once dismissed Apollo as a contamination risk, now spent hours analyzing chromatography results from samples Apollo had identified. The implications extend far beyond individual case detection. Dr. Thornton explained during a presentation to the hospital board, by identifying which specific compounds elicit canine alerts, we can develop targeted screening protocols and potentially new sensor technologies that mimic these capabilities. The relationship between Meredith and Dr. Thornton had evolved into a productive professional partnership built on mutual respect. His initial skepticism had transformed into scientific curiosity, while her advocacy had become more evidence-based and methodical under his influence. They complemented each other's approaches in ways that strengthened the program's credibility and effectiveness. I've been thinking about Apollo's succession planning. Dr. Thornton mentioned one afternoon as they reviewed data from recent hospital cases. He's 7 now, correct? We should consider implementing a training program for the next generation of detection-capable therapy dogs. Already ahead of you, Meredith replied, showing him photos of 3 golden retriever puppies from Apollo's biological nephew's litter. The breeding program at Southeastern Working Dogs has reserved these 3 for possible therapy while detection work. They're demonstrating promising early scent discrimination capabilities. Dr. Thornton studied the photos with uncharacteristic sentimentality. They have his eyes. He observed that same focused intensity. Meredith hid her smile at his unexpected attachment. Apollo will help train them once they're old enough. His experience will be invaluable in developing their natural abilities. 5 years to the day after Apollo first alerted to Lily's fungal infection, Meredith received a phone call that brought their journey full circle. Ms. Campbell. The voice belonged to Catherine Matthews, though it carried a tension Meredith hadn't heard since Lily's hospitalization. I'm sorry to call out of the blue, but we're at University Hospital with my mother. The doctors are struggling with a diagnosis, and Lily insisted we call you and Apollo. Within hours, Meredith and Apollo arrived at University Hospital's geriatric care unit. Lily, now 12 years old and significantly taller than when they last met, waited anxiously in the corridor. She had grown into a confident young adolescent, her earlier frailty replaced by healthy vigor. Those shadows of worry now darkened her eyes. "Apollo," she exclaimed, kneeling to embrace the dog who had saved her life. "I knew you'd come. Of course we came," Meredith assured her. "Tell me about your grandmother's situation." As they walked toward the hospital room, Lily explained with surprising medical precision, "Grandma started having balance problems and confusion about 3 weeks ago. The doctors thought it was a stroke at first, but the brain scans were negative. Then they suspected a urinary tract infection causing delirium, but antibiotics didn't help. Now they're talking about degenerative neurological conditions, but nothing fits exactly right." Inside the room, Eleanor Matthews lay against white pillows, her silver hair creating a stark contrast. Though clearly ill, her eyes brightened at the sight of her granddaughter with Apollo. "So this is the famous dog I've heard so much about," she said, her voice weak but warm. "Lily hasn't stopped talking about you for 5 years." Apollo approached the bed cautiously, his demeanor shifting immediately into assessment mode. After a brief greeting, he began a methodical investigation, sniffing carefully around Eleanor's body, with particular attention to her head and neck. Dr. Christina Moore, the attending physician, observed with professional interest, "Lily was quite insistent that we consult with you." She explained to Meredith, "Given the hospital's participation in the IARP network, we were able to expedite the approval." Apollo's attention focused with increasing intensity on Eleanor's right ear. His alerting behavior became unmistakable, the same pattern he had shown with Lily's infection and Marcus's arsenic poisoning. "He's detected something specific," Meredith explained, documenting the behavior on the standardized IARP observation form. "The focus on the ear area is very precise." "Her right ear," Dr. Moore confirmed, reviewing her notes. "She did mention some mild discomfort there early in the presentation, but the initial examination showed no obvious infection or abnormality." "Could it be something deeper in the ear canal?" Meredith suggested, "or perhaps extending beyond the ear itself?" Dr. Moore considered this thoughtfully. "We haven't done high-resolution imaging of that specific area. The standard head CT was focused more on ruling out stroke or obvious masses." Within hours, Eleanor underwent specialized imaging that revealed what previous examinations had missed: a small cholesteatoma, an abnormal skin growth behind the eardrum that had become infected, gradually expanding to press against her cerebellum. The subtle pressure explained her balance issues, while bacterial toxins from the infection contributed to her cognitive symptoms. "It's relatively rare in someone her age without a history of chronic ear infections," Dr. Moore explained to the family. "And the symptoms can mimic many neurological conditions. Without Apollo's specific alerting behavior, we might have pursued numerous other diagnostic pathways before identifying this. The surgical removal of the cholesteatoma and treatment of the underlying infection led to rapid improvement in Eleanor's condition. Within days, her balance stabilized and her cognitive function began returning to normal. 5 years ago, Apollo saved me," Lily told her grandmother as they prepared to take her home. "Now he saved you too. It's like our family has a guardian angel with 4 paws." On a brilliant autumn morning, 7 years after their first hospital visit, Meredith and Apollo stood in the hospital's newly redesigned lobby. Behind them, a bronze plaque was covered with a blue cloth waiting to be unveiled. The space around them filled with hospital staff, former patients, researchers, and supporters of the program that had grown from one dog's persistent, alerting behavior. Lily Matthews, now 14, and seriously considering pre-med programs for her eventual college application, stood with her family in the front row. Beside them, Marcus Chen, his hands now steady enough to have resumed his promising career as a young pianist, waited with his parents. Dozens of other former patients whose lives had been touched by the program gathered in widening circles. Dr. Sullivan approached the podium, her practiced public speaking voice carrying easily through the spacious lobby. 7 years ago, a therapy dog named Apollo refused to leave a patient's bedside. His persistence eventually led to the discovery of a life-threatening condition that had eluded conventional diagnosis. What could have been dismissed as an animal's misbehavior instead became the foundation for what is now an internationally recognized approach to integrating canine detection capabilities into modern medicine. She gestured toward Meredith and Apollo. Through the dedication of his handler, Meredith Campbell, who advocated tirelessly for her partner's observations to be taken seriously, and the eventual scientific validation, championed by our own Dr. Alexander Thornton, the Integrated Animal Response Protocol has now been implemented in over 100 hospitals worldwide. Dr. Thornton stepped forward, his customary formality softened by the significance of the occasion. The statistical impact of this program is substantial. In the past 5 years, documented cases of condition detection through the IARP network have resulted in earlier diagnosis and treatment for more than 700 patients. The estimated improvement in medical outcomes represents approximately 92 quality-adjusted life years gained. He paused, then added with uncharacteristic emotion, "But beyond the statistics are the individual lives, the children who continue to grow up, the artists who continue to create, the parents who remain present for their families. Each case represents not just a medical outcome, but a human story preserved." Together, Dr. Sullivan and Dr. Thornton unveiled the plaque, revealing the bronze likeness of Apollo in his therapy vest, head slightly tilted in his characteristic listening pose. Beneath the image, the inscription read, "The Apollo Initiative, established 2023. Where science meets compassion." Recognizing that healing comes in many forms, and wisdom speaks in many voices, some without words at all, the ceremony concluded with the announcement of the Apollo Scholarship for Integrative Medical Detection, a program that would fund research at the intersection of animal behavior, biochemical marker detection, and clinical diagnostics. As the crowd dispersed, Meredith knelt beside Apollo, whose muzzle had whitened with the passing years, but whose eyes remained bright and alert. At 10 years old, he had begun transitioning toward retirement, his hospital visits becoming less frequent as a new generation of therapy dogs, including his protégés, continued the work he had pioneered. "You've changed the world, boy," she whispered, stroking his golden coat. Not bad for a dog who once got in trouble for breaking protocol. Dr. Thornton approached, accompanied by a young medical resident. "Ms. Campbell, Dr. Winters and I were hoping you might join us for lunch. We've just received preliminary results from the multi-center validation study that are quite remarkable." He glanced down at Apollo with unmistakable affection. "And of course Apollo is invited. I've taken the liberty of reserving the restaurant's patio section to accommodate him." As they walked toward the hospital exit, Dr. Thornton falling into step beside her, Meredith reflected on the journey they had taken from adversaries to allies to something approaching friendship. The physician who had once demanded Apollo's removal from the hospital now regularly carried dog treats in his coat pocket. "I've been reviewing our initial documentation from Lily's case," Dr. Thornton mentioned. "It occurs to me that we never properly quantified the probability calculation, the statistical unlikelihood that Apollo would focus repeatedly on the exact anatomical location of a hidden infection by random chance." "And what did you determine?" Meredith asked, knowing his affinity for precise mathematical analysis. "Approximately 1 in 63,000, he replied. "Or expressed differently, a 99.98% probability that his alerting behavior represented genuine detection rather than coincidence." He adjusted his glasses thoughtfully. "By the 5th documented case, the probability against random chance exceeded 1 in 10 million. "So you're saying Apollo was right all along?" Meredith teased gently. Dr. Thornton's lips curved in a rare smile. "I'm saying that sometimes the most sophisticated diagnostic tool in the room has 4 legs and a wet nose, and that a willingness to consider unexpected sources of information may be as important to medical advancement as technology itself." Outside the hospital entrance, Apollo paused to lift his face to the autumn breeze, sunlight gleaming on his golden coat. Around them, leaves drifted from the maple trees that lined the hospital drive, creating swirls of amber and crimson against the clear blue sky. Nature's reminder that change, when embraced, brings its own distinctive beauty. A young girl in a wheelchair approached, her face lighting up at the sight of Apollo. "Is that the famous Dr. Dog?" she asked Hope, brightening her eyes. "Yes," Meredith replied, guiding Apollo toward her. "Would you like to meet him?" As Apollo gently greeted the child with his characteristic empathy, Meredith watched the connection form, the same magical bond between canine and human that had saved Lily's life, transformed medical protocols, and reminded an entire profession that healing sometimes begins with simply paying attention to what our oldest companions have been trying to tell us all along. In that moment of connection, the circle seemed complete. Yet Meredith knew this wasn't an ending, but rather another beginning, another opportunity for the unique partnership between human science and canine intuition to discover what might otherwise remain hidden, to heal what might otherwise remain broken, and to build bridges between worlds that only separated because we forgot how to listen across the divide.